Hi, I'm Dr. Jeffrey Annamarino from Bellissimo Plastic Surgery and MediSpa. Welcome back to another live Facebook event. Tonight we're going to talk about a really important subject. This is something that everybody needs to know about, whether you're taking care of toddlers at your house, you have teenagers, just for yourself, or you're taking care of some elderly family members. You need to know about sun safety, sun protection. We're going to talk tonight about how to use sunscreen, what clothing you might wear, what causes skin cancers, what is tanning beds, how do they affect everything. So we're going to talk about that tonight. Today is, as we kick off tonight and going into July, it will be our second sun safety campaign. We're going to have a special facial that Tara will be doing in the office. This will be a balancing seawater aloe facial. For everybody that signs up for that, we're going to donate $5 to the Pittsburgh Women's Shelter. We have a campaign drive for sunscreen and hats. So anybody that would like to donate to either the office here in Shadyside or the office in Monroeville, they'll get 10% off of any of the esthetician services. And lastly, we have a gift basket with some great fun in the sun things as well. We have over there a towel, hats, some certificate for some facials, sunscreen obviously, since we're going to be talking about that tonight. We're going to raffle that off on Facebook, so good luck to everybody. And to help me tonight go through some of the pratfalls and maybe some of the things that people don't know, I can't tell you how many times patients have said, I don't understand why I'm getting skin cancers. I use sunscreen, but they're using sunscreen later on in life. It's all cumulative hits since we were kids. So we're going to work through that. I have a really great guest tonight, and this is Dr. Christie Regula from the Vujevich Dermatology Associates. She's a board-certified dermatologist, so who better than to ask questions to? She also has a really great project. It's very innovative. It's called Smart Pittsburgh. I'm going to let her tell you about it, and hopefully some of us will be encouraged to help their practice get involved with this, because it really is something that's fascinating and really helpful to the community. So with that, Dr. Regula.
Yes, thank you.
Nice to have you here.
Thank you for having me. I really appreciate it.
Great. So tell us all about SunSmart Pittsburgh.
Yes, so SunSmart Pittsburgh is an official 501c3 nonprofit organization, and our mission is to promote sun safety and skin cancer awareness through installation of public sunscreen dispensers, such as the one we have here. And so my partner and I started this about 2 years ago by installing a public sunscreen dispenser in a local park. And the purpose really is to have sunscreen there when people need it. And how many times have you gone to the park and it's a cloudy day and you get there and the clouds go away and the sun comes out and you don't have sunscreen, your kids don't have sunscreen. So I wanted to make it available for people to use and to reapply, which we'll talk about a little bit later. And over the last 2 years, we've really expanded our program to now include sunscreen dispensers at 24 city parks. We have a partnership with the City of Pittsburgh and their Public Works Department that help us take care of the sunscreen dispensers. So that includes ball fields, playgrounds, running trails, tennis courts, deck hockey, spray parks. Any recreational areas around the city is really our goal to get the dispensers into.
It's a great idea. So, we're always encouraging everybody to use sunscreen. Take it with you, put it in your purses, your bags, have it in the car. But this is really a great idea, and I'm really impressed. So how did you get the idea? What prompted you? Where did it come from?
So as dermatologists, we obviously see skin cancer every day. And we realize that we're doing a great job with detection and treatment of skin cancer. We might be able to do a little bit better job with prevention. And that's really where we wanted to start affecting change with the prevention of skin cancer and education on how to prevent it. And that's really where this came into play. There were sunscreen dispensers installed about 4 years ago in Boston city parks and also in Miami beaches.
Oh, right.
And so that's sort of where the idea originated, and we thought, well, why can't we just do it here? And that's what prompted us to start the first sunscreen dispenser, and then we've kind of evolved since then to be what you see today.
That's great. So as we go through, tell us, I want you to tell us how, if we want to get involved or if anybody wants to get involved, how do we do it?
Sure.
And because it really is. Skin cancers, whether you're talking about basal cell, squamous cell, the most deadly is melanoma, I mean, these are on the rise of some of the fastest growing cancers in not just the United States, but in the entire world. And there are lots of beaches, even in Australia, where kids have to have the sun protective clothing or they're not allowed to be on the beach.
Sure.
And so, so their governments are getting involved and, enforcing these laws. But we don't really realize it, and especially when you get to be my age, and I came through, in the 80s, and everybody was out getting sun, and we all feel good with a tan, and lots of people like to tan
Sure.
and to sun. But growing up in California, when I came here, there was a lot of the tanning beds, the tanning salons were everywhere. It was like worse than Starbucks.
Yeah.
And there was a lot of myths, I think, that were out there. And I think we're going to talk about some tonight, like, using a tanning bed to protect you as you come out of the winter. The base tan, I had to have a patient explain to me what a base tan was.
Mm-hmm.
And so I think we're going to go through some of that. So hopefully this will be very educational for everybody, and also to help promote, and so we can get more of these out there.
Yeah, that would be wonderful. We're constantly growing, and we're always looking for volunteers to just give us ideas for locations.
Mm-hmm.
The more people that we get involved in the community, the better. Girl Scout troops, Boy Scout troops to help maintain the dispensers. We're always looking for people that want to get involved in the community.
Right. If you can get your kids to start doing it at a younger age, then they're going to be more prone to doing sunscreen for the rest of their life. It was a hard thing for me to start, and even with our kids. And then the problem was, I think the biggest thing that people mistake is when to put it on. So you get to the beach, you get to the pool, you get where you're going, and you get your kids out of the car, and then suddenly it's like, okay, you strip off their shirts and everything, and you start putting sunscreen on, and they're out running around. And it's really too late at that point. You haven't taken advantage, because it takes some time for the sunscreen to be set up. It takes about 20 minutes for that barrier to be set, and so you're already getting sunburned, or your kids are getting sunburned, and then the damage starts at that young age. So even as the parents start saying, well, I didn't use it, but I'm making sure my kids do it, one of the biggest things is how to use it effectively.
Sure.
And so I'm sure that you preach that all the time, as I do.
All the time. And I think you're right. Part of what we're trying to do with this is also to put it at playgrounds. And so
Mm-hmm.
it is a good, you're setting a good role model for your kids from an early age, so that they're aware that they need to do that.
Well, I think some of the antibiotic ointment companies, like Neosporin, has done a great job. They market it. They almost make moms feel bad if they don't have a tube of Neosporin. A kid gets, he falls, gets a scrape, you got to have that Neosporin on there. So, we're kind of growing up with that sort of education. So that's why I think this is great. You get to the park and reminder, and even the kids can remind the parents, you know what, I don't have the sunscreen on.
Sure.
And my kids in a teenager, young teenagers, they'll still say, it's kind of cloudy, do I need to wear sunscreen today? So, yes.
That's great, because
Yeah.
you started them early. So that's
Right.
kind of the time that they start to sort of forget, and they want to get a tan and fit in with their peers. So that's really important. An interesting piece of information too that I'm not sure that people know is that there's currently legislation in the Pennsylvania state government to help kids apply sunscreen at school, because currently sunscreen is considered a medication. And so if you want your kids to take sunscreen to school and apply it, it has to be in the nurse's office, and the nurse has to apply it.
I didn't know
So
that.
there's a lot of barriers to being able to have kids to use sunscreen on their own independently. And so a lot of states have passed legislation to make an exception for sunscreen so that kids can have it on sort of their person and be able to use it. And so that's a big goal of the Pennsylvania Academy of Dermatology currently, to really push through that legislation. So if you're out there, if you know any state legislators, put in a good word.
Yeah, no, that's fantastic. I didn't know that either. It's kind of a shame that it gets
really
to that
is.
point where you have to actually have legislation to do the right thing.
Right.
Okay. Go ahead.
What SPF do you recommend? And what do you have in
Sure. So in the dispenser, we have an SPF 30 sports sunscreen, which is water resistant. And you really do want an SPF of 30. Once you get above 30, the debate continues of whether or not SPF 100 is better than 30.
Right.
But at least an SPF 30 is what is recommended by the American Academy of Dermatology.
That's good, because that's what I've been recommending.
Yeah.
So it's nice to know
Yep.
that I'm on board with that. But I think that's one of the other thing that's the most confusing is the numbering of the SPF, and what when you read about why they call it SPF 15, 30, 50, 45 and above, it's really the amount of time that it would take you to burn, and most times, like I said before, it takes about 10 or 15 minutes to start a sunburn. Then SPF 15 is 15 times that, and then 30 times that. So, but the idea is to the rest of us is, well, 30's got to be twice as good as 15,
Right.
and if 30's good, my kid needs 50 or 100, and they really don't offer much more protection above 30, right? I mean,
That's
it's
correct.
just,
So SPF 30 blocks about 97% of the sun's rays, and when you get to 60, 80, 100, it's about 98. So the difference between 97 and 98 is pretty negligible. I'll tell you where it does make a big difference, though, and if people do not use enough sunscreen.
okay.
So you really have to use 1.5 ounces of sunscreen for the entire body. That's about the size of a shot glass, a good comparison for people.
Okay.
It's a lot. And so people do not often use that much on the body. So if you do not use enough, it basically cuts the SPF in half.
Oh, okay.
So if you're using a 30 but you're not quite using enough, then you're probably actually only getting a 15.
Okay.
So not that that's a reason to buy 100 and only use half as much, but just be aware of that may
Right.
be a reason that people are putting sunscreen on but feel like they're getting a tan or burn through it.
Okay.
They may not be using enough.
Well, I was always sort of under the impression, and I've been taught, that when you start getting above 45, really, the amount of chemicals in it, if you have sensitive skin or you have a young child, sometimes the chemical formula may be irritating to the skin. I'm not sure of how true that is, so I mean.
I'm not sure of that. I do know that, as you get higher, there are different chemicals that are certainly used for stabilization of the sunscreen. And that can certainly add to some of the sensitivity that people can have to sunscreen as well.
Okay.
If people do have sensitivity, really the best sunscreens to use are physical blockers, which are titanium and zinc,
Right.
which is really found in most baby sunscreens. So if you do have sensitivity, those are the best ones to stick with.
Yeah, and zinc oxide, when I was a kid, that was the lifeguards that had the white nose.
Yes.
That was, and they work the best because they're barriers.
They work great.
Right.
Nobody wants to use those anymore, so
Right.
they micronize
Well,
the
they
zinc.
have them all in different colors now. So they have purple, and
Right.
but they have some more skin colors too. But those are physical
They are
barriers.
great.
So that's not out there. One of the questions I have, and I got to ask
Yeah.
you, is because patients will ask me. I preach about it every day when I'm seeing patients about the spray sunscreens. Because kids don't want to be rubbed on them. And so the spray. Are they as effective as long
certainly-
as you're using enough?
That's correct.
Okay.
So they certainly can be just as effective, but I always tell people when you're using it, it should be a very slow spray.
Okay.
It's not that you spray a mist and just walk through
That's
it.
right.
So
It's
you
like putting on cologne.
Right, it's never exactly. That's what most people do. It really should be a slow spray so that you're physically wet, and then you do
Okay.
actually have to rub in
Okay.
kind of the dampness on your skin, and they can be just as effective and easier to use in certain areas of the body.
Okay, great.
Now, you talked about how much to use. How soon should you put it on before you go in the sun? And how often do you reapply? I know we always talk about applying, reapplying. Can you touch
Sure.
on that?
So I agree, 20 minutes, 15 minutes before you go out is really important to apply sunscreen in that time frame to give it time to be effective before you go outside. The other thing that you should do is actually look at your sunscreen to see if it's water resistant. Water resistant sunscreen is good for about 80 minutes, even if you're swimming or sweating. If it's not water resistant, it's only good for about 50 minutes. And so what a lot of people don't know is that you do have to reapply sunscreen quite often.
Okay.
So it's really about every hour and a half is a good rule, and that's even if you're not swimming or sweating.
Oh, well, okay, that's even a little bit.
Does
Sooner.
sunscreen expire?
If you had sunscreen from last year, you should probably throw it away. And if you have it from last year, you probably were not using enough. Because remember, 1.5 ounces, that bottle's only like 6 or 8 ounces. I mean, you really should be going through it if you're at the beach. So.
Do you need to put sunscreen on the tops of your feet, scalp, ears? We
I
touch
think
on
anything
that.
exposed.
You definitely do, absolutely. And even for patients that are getting later in years, do not forget the top of your scalp and even your thinning hair. A lot of women, although women do not have the same hair problems that men have, they do experience thinness over time. And so
Yeah.
you can also get skin cancer on the top of your scalp and in
Right.
between your hairs. So
And you may not even see those, that's the problem. And the
Exactly.
biggest problem is if you start to develop a melanoma in those areas. But I've had patients come in with squamous cell that is a large, ball. And, by then, it can be dangerous because it can get into the skull, and then it's very hard to treat. And so, you know, if you do, you want to get it early. But, you know, you do have to you know, get on every area that's going to be exposed. Here's the other thing that I saw a lot more in California than here. Patients will go out. I mean, out here everybody plays golf. Out there, people play golf, but they were on their boats or out in the pool a lot more. You know, so everybody says, well, I have a hat on, but I can't understand why I'm getting burned. Because there's reflection off of the water. Anybody who skis knows even on a cloudy day, you can get burned just because of reflection off the snow and the ice. So you have to be aware that ultraviolet light bounces, especially ultraviolet B. It will bounce, you will get burned from it. So if you're near water and it's not enough just to wear even a large brim hat, you have to do both because everything's coming under the brim.
Absolutely. And I think that speaks to a really good point in that the more ways you can protect yourself from the sun, the better.
Mm-hmm.
So if you have sunscreen on and you have a hat on, and if you have sun protective clothing on, you seek shade, all of those things combined really are much more effective than any one method of sun protection.
Terry wants to know if you plan on expanding the sunscreen program outside of Pittsburgh.
So we certainly do. We would love to see it all across Western Pennsylvania. And we are in our second year now and gaining momentum, which is great. Yeah. And with that, hopefully gaining more funding to be able to expand outside of the Pittsburgh city proper.
Oh, that's fantastic.
One of the questions I have, if you're darker complexion, as Dr. Antamarino, do you need is sunscreen still as important? Does it matter your complexion or?
It really does still unfortunately matter, and it's a very common myth that people always kind of reach to in the office, and they say, well, I get tan, but I never get burned, so it's okay. And it's unfortunately not. You know, any sort of tan that you get or color on your skin is sun damage. And as you alluded to earlier, that might not show up for another 30 or 40 years. And so it does lend sort of a false sense of security,
right.
But it is still very dangerous.
Yeah, and it's true. I mean, that was one of the big myths that African Americans don't get skin cancer. It's absolutely wrong. Everybody can get it. So you do have to really think about that. And again, it's, as you said, it's a 30 to 40 years sometimes. If you don't, you know, if you have darker skin, it may take that long. If you're fair skinned, I mean, I had a roommate in college that started getting on his lip, but he was out surfing all the time. But by the time he was 20 years old, he already had a squamous cell of his lip, and he was redheaded and fair skinned.
Terry wants you to know that Ohio Pile would be a great place at the rafting rentals there.
Terry, that is a great idea. I am from Uniontown, Hopwood actually right at the foot of that mountain.
Oh, that's a great idea.
I would love to have them at Ohio Pal, so thank you for the suggestion.
That is good.
Mm-hmm.
Are there any organic alternatives to sunscreen?
That's tough, you know, so the closest I think you really get to organic are some of the baby sunscreens, which are titanium and zinc. But other than that, most of them are chemically based. There have been no studies showing that that really gets internally or that you absorb a large amount to have it be harmful, so that's important to know as well.
Okay.
If someone hasn't worn sunscreen for years, is it too late to start?
It's
I
never
hope
too
not.
late. No, it's never too late. And often I find, and you may find this too, it's frustrating for patients because maybe in their 60s they start being really good with sun protection.
Yes, I mean, then it'll upset because they get a skin cancer.
Exactly.
I was like, yeah, but you still have to use it because you're trying to prevent, because you have to remember there's cumulative damage, and it only takes one extra hit to start the process. And I'll tell you something that hit close to home for me. So my dad was completely 100% Italian. He laid out, he could get, I mean, much darker than I get, and never wore sunscreen. And I used to tease him a lot as he, you know, as I got older and then got into medicine and doing what I do in plastic surgery. And I said, it's amazing to me, you've never had a skin cancer. You're going to get skin cancers. I'm telling you, you have to start using sunscreen. Ironically, my dad developed melanoma, and he developed it in his eye to start. So as we talk about, it's not just skin. You have to protect everything. You have to have sunglasses on that are ultraviolet protective. Last year we had Dr. Talega on, who's an optometrist, and she really went into that. So I can tell you from personal experience. And then, so my dad had it in his eye, and then last August actually died from melanoma that was widespread. I've seen my father go through it. You never want to see somebody go through that. So you have to protect it. And again, he was 76 years old, so or 78 years old, and so it took a long time for that to happen to him. But at the end, that's what got him. So you have to start thinking about it now.
You really do. And I always tell my patients that in their 60s or 70s, maybe when you were young, we didn't know any better, but we really need to be better with the next generation. And I think we're doing a better job. I really do.
Yeah, absolutely.
Well, talking about your dad and tanning, so what is your opinion on tanning? Because as we've talked about before in the past, people always think they feel better and look better with a tan. So any suggestions about that? Base tan, is there?
Personally, what I tell patients is there's no tanning beds. Never tan, and especially the ones that have them at home. There's no regulation. You don't even know what you're getting. But even the ones that are out there, and I'm not trying to put anybody out of business. I think everybody has a right to make a living. But the studies do show that your risk of basal cell and squamous cell cancer is much, much higher. But melanoma is through the roof with those tanning beds. And that's when somebody had to explain to me what a base tan was. There's really no protection from a base tan. I mean,
there's really not. And the idea of a base tan is that if you get a tan, it protects you from further sun exposure, which is not true at all. And so one, the whole theory behind it just isn't good. And two, that base tan is really damaging as well. And I agree with you. And every time I hear tanning beds, I just kind of shiver a little bit. Melanoma is now the second leading cancer cause of death in young women. And the reason for that is tanning beds. So it's scary.
It is. And, and when you're in those tanning beds, I mean, you're tanning everything. And so, it's not good. The other thing that I see that's sort of touted either by the tanning bed salons and the patients that use them, well, we only use ultraviolet A. And so that's not a problem. But listen, ultraviolet A, UVA, UVB both cause cancer, both cause aging. So even if you don't get a cancer, you're going to be seeing me at some point for sun damage. So, I'm going to tell you, UVA and UVB are both detrimental. And, even in the small amounts that you use them. And one of the studies I showed you that I read, it was right out of the Dermatology journals, is that even if you're using a tanning bed once a month, so not very frequently, your risk of melanoma is 1 in 15. So it's crazy because it's about, I'm not sure what the numbers are. When I started in general surgery in the mid-90s, we were quoting 1 in 250 people. Now it's about 1 in 100 for the average population. So that's, when you look at the numbers, that's logarithmic. It's absolutely exponential, the amount. You think, well, 250 and 100. It's not simple math. This is, a huge steep curve. But if you go from 1 in 100 to 1 in 15, it's a lot of problems. Absolutely. And I didn't think about it as far as young ladies because I guess they're using tanning beds.
Right, and especially when you were, even when I was young, we did it for the prom and things like that. I hate to say my time may come, and so I'm very careful now and have been for a long, long time. But if you use it whenever you're in your teens, when does the damage show up? Not very much later. I mean, it's as you said, exponentially faster damage than it is that somebody that got a tan whenever they were 20 and now they're 80. Right,
because remember, you're in a tanning bed, a few minutes. So it's concentrated. I mean, you're getting, in about 10 minutes, 15 minutes, you're getting like a whole day's worth of ultraviolet light all at once. So there's no way to protect against that.
There's really not.
What about spray tans or sunless tanners?
So the evidence for spray tans and sunless tanners is that they are safe. And so what they basically do is the top layer of your skin, the stratum corneum, which is a layer that sheds off in about 7 to 10 days. It basically lends a color to that layer of the skin, which is why it usually only lasts about 5 to 7 days before the skin sheds. And so they are safe. And
there's some great colors. I mean, there's some places out there that, ladies will come in the winter, and I usually say, okay, you need to hear my lecture on sunscreen, tanning beds, and they said, no, this is a spray tan. So there's some, and they look very natural now. They're not that orange color from years ago.
They've really come a long way.
Yeah, and I had read something last year that the spray tans were coming from the old, it was a QT or something. I remember when I was a kid, there was a self-tanner that was, you put it on, and it was supposed to, and it was FDA approved to cause tanning. but the spray tans are sort of that same product aerosolized. And so the FDA was actually going back to look at that because the spray tans were not FDA approved, although they're being touted as FDA approved because it's a similar chemical. But they're saying, well, that was the liquid form, but we need to see if the aerosolized form. And so I don't know if that's ongoing. I mean, if you know anything about it.
I
it's just
don't
something
necessarily, one word of caution that I do want to say is if you are getting a spray tan, you do have to be very careful about what you inhale. Exactly, because
and
we're
that's
not,
what they're looking at is,
yes.
Is it damaging as inhalation, not to your skin?
Right, so you have to be very careful with that if you're having one done. The ones that you apply to your skin yourself at home, obviously you wouldn't have that same issue with.
Right.
So can we talk a little bit about the different types of skin cancer and what we should be looking for, if there's something, how often we should
I'll kick that over
Okay.
to you.
So there are basically three main types of skin cancers. There's a lot more rare ones out there, but the three main types are basal cell, squamous cell, and melanoma. And those are in order of, in order of incidence. So basal cell is the most common, then squamous cell, then melanoma. They're also sort of in order of seriousness, right?
Yeah.
So basal cell is the kind of skin cancer that just stays right in the skin. It luckily does not spread anywhere else in the body. However, over time it can be what we call locally invasive. So it can grow, it can bleed, it can become sore, and just be bothersome.
Right.
Squamous cell has a very wide range of severity. So some that are caught very early do just stay in the skin as long as they are removed promptly. But as you sort of insinuated earlier with the squamous cell on the scalp, there are some that can become quite serious quite quickly and unfortunately can spread to other areas like your lymph nodes and lungs.
Right, and I've had a couple of, they're all gentlemen actually, where they were large open wounds that were about 20 years in duration. And, you're talking about 500 square centimeters, where I had one gentleman, was his whole flank that was just raw down the muscle. And then, on biopsies, it was in the muscle, and you can't even irradiate that. So another gentleman was the whole back of his neck down to the strap muscles of his neck. And so they later passed away from something that even as a squamous cell, that starts off tiny, and you have a 1 centimeter incision to get rid of it, and now died from it. So it really is something. I guess the thing that I tell patients, and you're going to be able to explain it better than I do, but if you have something on your skin, anywhere on your body, that is a patch of dry skin that clears up and comes back right in the same spot, or it breaks down and it bleeds a little bit, and then it heals up and it seems to come back and is off and on, that needs to be checked out, because it's most likely it's a basal cell at that point. But it could be a squamous cell. They mask themselves. They look like other things.
They really can.
Patients will come to me and say, "Can you look at this?" And as we were talking about earlier, I usually say, if it's obvious, then I'll say, yes, it's obvious, we need to biopsy it. But if it's not, then I always recommend see a board-certified dermatologist. You should get, especially if you're fair skinned, fair complected, you should get it checked head to toe every year, especially in the scalp, places you're not looking, under the toenails, in between the toes. And if you've had a history of any skin cancer, then you really need to go and be surveilled. But I'm not the guy to do that. I don't see enough of them that I could tell you, unless, again, it's blatant. But even with melanoma, I mean, what are you looking for? What are your signs for melanoma?
So for melanoma, as you kind of alluded to, with basal cell and squamous cell, it can look like a scaly patch, or you think it's a pimple that doesn't go away, or just a bleeding sore. For melanoma, it really is a dark-looking mole often, and it can be a mole that over time has changed and become darker or larger, or it can just show up on your skin, and from the moment it's there, it can be a melanoma, which is a little bit scary. And so what you're looking for, I think, as a patient, is any mole that is bigger or darker than your other moles. We often call it the ugly duckling sign.
Mm-hmm.
So if you look at your arms and all of your moles look similar, but one stands out because it's bigger or darker, you should get it checked. As dermatologists, we use some different tools to help us really examine a mole more closely, and one of those is dermoscopy, which is a specialized, polarized, basically magnifying glass with a special light on it. And it really allows us to see the pigment and the different layers of the skin to be able to determine a little bit better if something does in fact need a biopsy after you've seen the warning signs.
All right, I don't know any plastic surgeon that has that device. So I'm half joking, but They really do. That's the problem with melanoma. It can be a 1 millimeter lesion and already spreading to other areas of the body. It's unlike any other cancer that we know of.
It really
And
is.
lots of other cancer. You talk about lung cancer, colon cancer. There's sort of this size that they get to, and then they start breaking away, and it's sort of a doubling time and everything else. But melanoma is its own worst enemy. I mean, it can pop up in any organ. Like I said, my dad had it in his eye. It can pop up anywhere on the body, and like you said, as soon as it pops up, it could already be there. So it's not really, we believe it's due to sun hitting another mole and damaging the mole, but it can just arise out of nowhere and already be there. So that's why you sort of have to just be your best advocate. It's like we talk to women about breast cancer. You do need to do self-exam. Same thing with this. You got to examine your skin and in the areas that you don't normally look at.
Absolutely.
How frequently should you go have a skin check done?
So I agree with, you should go in and get your skin examined at least once, right? You have to know what you have. And then it's much easier for you to watch for any changes. And you can employ a spouse's help. You can take photos at home on your iPhone or whatever cell phone you have and compare those. It makes it very easy for your family to help. But once you see a dermatologist to have your skin examined, they can give you a little better idea of how often to come in. And that's really based on the amount of sun exposure you've had over a lifetime and the sun exposure that's present. So it's usually every year, sometimes every 2 years if someone is young and doesn't have a lot of moles, or if someone has a lot of sun damage and a history of skin cancer, it can be anywhere from every 3 to 6 months.
Are you more at risk for skin cancer if someone in your family has had?
So,
Good question.
yeah, that is a good question. The answer is yes. And for melanoma, there are familial types of melanoma. So if a first-degree relative, so that's father, mother, even sibling, has had a melanoma, you're at a higher risk. But you're also at a higher risk for basal and squamous cell. And really the reason for that is, I think, not so much in your DNA, but it's lifestyle, and it's hair color, and it's skin color, and eye color. It's all of those things. So family members do the same things outdoors, and they have the same kind of skin. So that's the reason I think that those run in families.
Right.
So you mentioned previously about ways to protect your skin, not just sunscreen. What were some of those examples again?
So a wide brim hat certainly is a great example. And that can be any sort of wide brim hat. It really should, straw hats are okay, but some straw hats have a much looser weave than others. So you want it to be a very tight weaved hat. And there are also hats that are just very lightweight and very breathable. So hats, sun protective clothing is great. We've come a really long way over the last 10 years.
Is it Coolabar? What?
Coolabar is a great
Coolabar,
brand.
that's it.
Coolabar, yeah. They're no longer like, they used to like fishing shirts,
Yeah.
put your tackle in everywhere. They don't look at that anymore. They're
Yeah.
basically just like a sports shirt, a very thin material. And for clothing, it is UPF, not
Right.
SPF. So most clothes are UPF 50, which is what you want to look for.
Where do you find those at?
You can really find them anywhere. A lot of companies have them now. So Athleta has a great line. So there are a lot of those stores around here, Coolabar, and really just a lot of other companies online. If you search for sun protective clothing, they all pop up.
Amazon probably has something.
I'm sure
you
they
know?
do.
But here's the other thing is that bathing suits, because I have a lot of ladies that say, well, I wear one piece, but the lighter colors, the ultraviolet light penetrates it.
Very
So you
true.
have to, so darker colors reflect it.
Mhm.
The other thing is that, even if you're behind glass, it can penetrate glass. There was a time, when we had, you could see men and women, where men would get skin cancers mostly on their left side and women on their right side, because men drive and women would be the passengers. You don't see it as much anymore because women drive as much. But in my parents' age group, because would come in through the left window or the right window, depending upon
Yes,
who was
what
on
side
that
you're
side. So
I think that's a
Yeah.
great point. It does come through car windows. Even if you're at your office and you're sitting in front of the window, you are still getting sun exposure. So it's important to wear sunscreen in those instances.
Terry wants to know, how much coverage does the sunscreen dispenser dispense at one time?
Yeah, great question, Terry. So the dispenser dispenses 1 milliliter of sunscreen. And so that's enough for about your face or like your forearms. And so one dispense face or one dispense forearms.
All right. Well, listen, if there's any other questions, we would certainly take them if you want to email us. and we'll provide all the information for Dr. Regula. And so once again, we wanted to, hopefully this was very educational, something to take home, because it really is protective. It really will help you prevent or notice a skin cancer early on rather than later on in life. So again, we'd like you to help us donate to our sunscreen and hat drive. Again, if you do, the Monroeville office and also here in the Shadyside office, we'll give you 10% off of an esthetician service. We have a great basket full of sunscreen and towels and hats, and so you can raffle. We're going to raffle that off via Facebook. And there's the facial. Let me see if I can remember this. The balancing seawater aloe sun facial, and if you do that, we'll donate $5 to the Women's Shelter of Pittsburgh. And please try to get involved with this. This is just a really great idea, and so we're going to talk afterwards about getting involved as well. So, and this is Dr. Regula from the Vujevich Dermatology Associates. So I'm sure we'll have all of her information. You can email her and find out some information as well. So thank you very much, and we'll see you next month.